level was 277.29 feet. That is the level that we recorded. I'm sure another data will come in around 2 o'clock to know whether it's increasing or not. So we normally collect the levels 3 times a day to make sure we are tracking the level in the dam.
So it appears that for the past 3 days, we are seeing some reduction in the inflow of water. Give us figures.
Yes, for the past, I'll say 4 days, we started around 380 plus thousand cubic feet. We came to 360. Yesterday it was 342, and today is 286,000 cubic feet of water. And the rise as of today was 0.05. Yesterday it was 0.1. A day prior was 0.02. A day prior was 0.04. So per our data, we know that from mid-October to the end of October, the water has to recede, and it's tracking that. So there's a bit of comfort and confidence that, look, our data is really coming to play, that the inflows reduce, and the amount of the rise of the dam will also reduce, so at least we can safeguard the dam and don't topple the dam.
But one would ask, why are you still spilling if the inflow appears to be reducing?
Okay, as I said, the rise is 0.05. We are spilling 185. The inflow was 200 and today was 286. So in there, there's about 100,000 cubic feet. That gave us 0.05. If I should stop the spilling, then I'm going to go to 0.01. I have a room of only 0.21 feet to reach the maximum operating level of the dam. And I can't risk that one. So if I should close the gate within 2 days, I'll achieve that level. Then what will happen? I have to open all the 12 gates to make sure I sustain that 0.7. I sustain a 2.77.5. For me not to do that, I have to maintain the split till I see negative rise of the lake. If it's negative, right, I know that at least the inflow and the outflow, they are not matching. So I can start reducing the gate opening to give a bit of relief downstream, of which I think per the data we are getting there.
Finally, we are told that the VRA has set up a fund. Tell us about that fund.
We are a state agency, and as a state agency, we work through the government. And with this situation that we have in hand, we have to make sure the people affected are relieved of all the stress that are going through. And per that, we have to ensure that there's enough fund available to make sure that people are comfortable and we save life. So we won't put a cap to the amount of money. All that we want is that the people who are affected should have a bit of relief and comfort. That is our main priority, is the life of the people.
That's the indication we're getting from the Volta River Authority on what the next steps are, opening a relief fund that will aim at supporting persons who have been displaced as a result of this exercise. It's a good time to bring in now Richard Kumado, who's a security consultant, as there are increasing calls for the declaration of a national emergency. Richard, it's good to have you with us. The Assemblies of God Church is the first to lead that exercise, donating some relief items, but yet calling on government and the president to consider declaring a state of emergency, looking at the sheer number of individuals who are being displaced as a result of this exercise. 26,000 at the last count. The numbers or the figures might go up. And VRA is still indicating to us that they will continue the spillage, which means that the effect will be more in the coming days. First of all, taking a look at all that's happened, is this the time for the president to consider the declaration of the state of emergency in that part of the country?
I think the dam is a sensitive national installation, and those who manage some of these installations will need to be circumspect at all times. Their decisions will have to be prudent. And it shouldn't be an aftermath before they'll be asking the president to detect what has happened, the damage that has happened, to declare the state of emergency. If you listen to the statistics given by the man, I think they are aware of what is happening. What they fail to do is to pick up the early warning sign. And if they have picked the early warning sign, which is an opportunity they missed, they would have educated the affected communities on time. They would have put in a preventive measure that would minimize the effect of whatever we are seeing today, and that would have included the funding at that particular time. And so to that extent, the effect has been very drastic, and I will support any relief agency or relief items that will leverage the pain of the people. Blessed, in situations such as these, what we could have done or what we need to do going forward is to do a proper and a quick safety and security risk assessment in order to know what is likely to happen in the next 10 to 15 days minimum and into about 3 months maximum. And that way, it feeds into the national declaration of a disaster management plan or a fund that will take care of the people, because the levels of effect are drastic and it affects on dimensional levels that you cannot pinpoint one area to say you are predominantly giving one category of funding or one category of help to certain people and the other people. It has to be scientifically measured and it has to be holistically performed.
And I want us to listen to the president once more, because the president has also been speaking for the very first time ever since this national disaster occurred. The president giving assurances that all of the relief items will be provided and that through the Ministry of Finance and the Inter-Ministerial Committee, some relief items, more of them might get to the Mepe community and its environs. I want us to listen to the president, and I'll have your take on that.
Apart from what NADMO is doing, we have also to think about the future. I'm aware that you are farming people. The people who are farming on the banks of the rivers. River banks that have overflown and destroyed many of the farms. So one of the things that the Ministry of Agriculture, the Ministry of Finance, and the Office of the President is going to be working with the District Assembly is to decide exactly the nature of the support. The water has gone away to enable you to do the farm.
I have Minister of Finance, Minister of Agri, President of Office, Wajadudu Gome, Benjamin Chie Kejola, Nukamia Wako Pere Agredelau, Pere Akpailau.
That's why I'm saying that the committee is working in several phases. One, immediate.
Committee in several phases. Veton. Egbanto Nyebe Nukemiao, Eke Be America Bagbe Machimo.
And then tomorrow. But I want you to know that in its powers to assist, to make sure that things are all right.
Medwe mana bianyebe jirudula awonu si anu level seme be miabe jimejijo katala miago.
Okay, the assurance is there from the president, and we know the rest is history. If you can and mind to comment on the other side of it, because you come from that part of the country, you might also share your opinion. But the president, first of all, giving assurances that this will be dealt with. Relief items will coming, and that he's in to help. Do you see that posture from the president?
I was a bit disappointed. It's important the president spoke about looking into the future. These are things we could have prevented them in the first place. So looking into the future means that we will need to look at the demarcations again. We will need to be people who plan ahead. Lack of proactive, proper planning is what
Richard? Okay, we seem to have lost Richard Kumado there, who was just about sharing his thoughts on, the latest comments made by the president. Also, my colleague Carlos Caloni has been to the community today, visiting some health centers, because as we speak, the Ghana Medical Association is set to deploy its team of doctors and medical professionals into the community, owing to the fear and warning, several ones of course, that there might be an outbreak of cholera possibly within the community. Well, Carlos Kaloni has been to some hospitals as well, looking at the aspect of how residents are coping in these trying times.
This is the clinic set up by the National Disaster Management Organization here at Kizito Senior High School for affected flood victims. So we would want to go inside to look at the facilities that they have here inside the clinic. And so you see they have a place that you can come and sit and you'll be attended to. We also have some of the affected flood victims here in the clinic who are here to seek medical attention from the officials here. And so I'll be speaking with one of the officials who is actually manning this particular health facility here on the Kizito campus.
We are having our clinic here. This is a clinic that mounted by the District Health Directorate to assist those that are here who cannot go back to the facility to take to receive a medical care. So we are here to help them. So at this place, we organize CWC, which is weighing, as we normally call it. We give immunization, we do family planning, we do general treatment here, then psychosocial support. We started on Friday, Saturday, and yesterday, and today we are here again.
Tell us about the numbers. Are they coming, the affected victims on this campus?
They wish to come, but majority of them, because most of their health insurance, those who wanted to come, their health insurance has submerged in the water. So they are not able to come. But those that are willing, they are coming. And those that they are supposed to pay, they pay token, not money, token. Because the drug is not a donor drug. It's a drug that the district has bought, so they have to pay so that we can get the money to pay back and get another.
So there's no arrangement for those who have misplaced their national health insurance card?
For now, I may say no, because we cannot take the decision on our own because we have authorities. So they have to come in and give us the directive before we can comply. Without that, we can't do anything on our own.
Okay, so what are the numbers since Friday up to now? How many people have you recorded coming to this clinic so far?
About 10 for now, from Friday to today.
Okay. A number of residents have misplaced their health insurance cards in the flood waters, and so that becomes a challenge for them to seek help from this clinic which has been set up here. I'm told that this nurse also has that challenge, so she's going to share her experience with us. So how devastating was the flood to you personally?
Personally, I feel scared as around 10 o'clock. I was staying close to a big dam, and that was the major area that the water is supposed to pass. So around 9:10, then we suspect that the water is coming closer. So before we realize, then it's almost closer to my door. So I have no option than to call our district health director. So immediately he makes sure the pickup from the health directorate came and packed my things to a safer place, and I moved. They make sure they get accommodation for us for now, and my colleagues are here to join me. So for now I'm with my friend at the moment, but since health is an issue, so I supposed to stay and take care of and help my sister for us to run this clinic before others to join us soon.
Which means personally you have been affected psychologically, but you also want to assist others who have been affected. So you decided to spend your time, instead of looking at your things, to be here to support others. So that Voleto piece, she is a victim of the flood, and she's also a nurse. But because of the situation, she has decided to, as a matter of fact, support others who are equally or who have equally been affected. This baby was delivered few days to the flood, and she has been displaced also. and because of that, the baby has been brought to this particular clinic here, and she has been receiving treatment and medical attention from staff here at this clinic. And as you can see, there are some medications here for those who may need it as part of arrangement put together by the District Health Directorate to ensure that flood victims actually get medical attention. And so that is the situation from Kizito. Reporting from Kizito, my name is Carlos Caloni for Joy News.
Well, the National Disaster Management Organization says it is continuing with relief efforts to ensure that some displaced residents within the Mepe community and its environs access more relief items. Sejisaji is a deputy director for NADMO.
The three districts, the three-town districts are the highest hit. North Town is the hardest hit, followed by Central Town. Then we have South Town. But we have safe havens only in North Town and Central Town. As for South Town, all the people affected in the communities have moved to stay with their relatives and friends. We have close to 2,500, 600 at Central Town. We have more than 3,000 people in North Town. North Town has about 9 safe havens. And Central Town, they are currently having 3 safe havens. But in both North Town and Central Town, they also displaced people who are living with friends and families too as well in other communities.
So all put together, all the 3 highest hit districts, what are the numbers?
Well, we've recorded over 9,000 for North Town, over 6,000 for Central Town, close to 4,000 for South Town. But in all the 8 districts, including Shai, Osudoku, Esujaman, Adan, we are getting close to 26,000 as we speak. And we are still getting more people. We do a review of the figures normally in the evening into the next day.
Out of this 26,000, what percentage do you have placed in the safe havens?
Okay, we have currently more than 6,000 in safe havens across all the districts because Adan has also started receiving people into their safe havens. Shai Usudoku has close to 700 people also in their safe haven.
Which means about 20,000 are out there and not in any of these safe havens.
Exactly. We have close to 20,000 completely displaced who are staying with friends and family as we speak.
What is the plan for those people?
That's what we are working on, and that is the critical challenge. So most of the complaints you hear are the complaints from those who are living with friends and family. We are trying to work through the assembly system, the assemblymen, the NADMO zonal coordinators to try and reach them with some relief items.
Well, we've been tracking the delivery or distribution of some of the relief items within the community.
While the Volta River Authority continues to battle the flood situation and continues to spill more water, the National Disaster Management Organization is equally doing its bit and sharing relief items to affected victims. As you can see here in your picture, there are a number of items in here. We have tea roll, and then we have some cooking oil. There's also buckets and all this. We don't understand what procedure the NADMO is using to actually share these items. And so I have with me the district director of NADMO to give us details as to what formula they are using to share the items. So we see these items in the bucket. Can you tell us how you went about arranging this, who are supposed to benefit and all that?
Actually, this North Tongue District NADMO, we actually take data every day. Actually, we receive the relief items from the NADMO and then so per this thing we cannot distribute the thing actually to just to the populace. So we have decided to move to every room per household so that we can get everybody on board to get at least the food stuff, basin, toilet roll, everything, so that nobody will stay without any relief items.
So the explanation is that what we see here is per a household. Is that?
Yeah, per household.
Okay, so I see in the 3 toilet papers,
yeah,
and about 2 buckets and some soft drinks. If a household has about 10 people, how are they going to share this?
No, it's more than 10. The soft drink is more than 10. The cup is more than 4. And then every house we make it up to 20. Every household we made it up to 20. So if any household is around 6 or 8, we normally find average for those things and give them the food items.
So the understanding is that what we see here is for a household of 20 people. Is that the case?
At times 6 people, 8 people, it depends.
Okay.
Because we'll be using the data to share it. We'll be using the data. Maybe some rooms or a household is up to 4, 6, 8, and 20.
Okay, so those
the distribution is done according to the number of the household.
So for how many households do you have at St. Kizito so far?
28. 28. We have 28 households. Yeah.
And 28 households in terms of individual numbers. What numbers are we looking at?
Actually, as at now, you are looking at around 560, getting to 600.
600 people. Yeah. But earlier, your Director General told us there are about 3,000 or over 1,000 people here, which means that what you are sharing, some people will be left out of it.
No, they will not be left out of it. It depends upon the distance. Actually, first is 3,000 going there, but people, as at now, they are decreasing, increasing. Do you get the point now? So anytime we find average for all these things.
Thanks for staying with us here on the Joy News channel. We're paying attention to the Akosombo Dam Spillage, but now it's a good time to cross over to the Electoral Commission's headquarters, where Samuel Tete, Director of Operations for the Electoral Commission, the Deputy Commissioner actually in charge of operations, addressing the press there on the back of the limited voter registration exercise. We can listen.
Registration exercise in offices. We indicated that we did not factor registration of voters on electoral area basis in our approved 2023 budget and work plan. The EC has not stated anywhere that Parliament is to be blamed for not approving its budget. Hence, its decision to register voters at the district offices. The EC stated that it prepared a draft CI for a continuous registration exercise in all its district offices nationwide. And had the CI passed, the EC would have had some 6 months to register voters at a time of their choice. The Commission also indicated in the previous press briefings that it encountered some challenges, including internet connectivity, on the first day, which were swiftly resolved. It is baffling to hear some people dwell on the initial challenges when these were resolved overnight. Our robust network and internet connectivity counts for the 90% of applicants who registered online, that is using the internet, and the 10% registered offline. Indeed, if there were issues with our internet and network, we could not have achieved this. On the guarantor system, the Commission is of the view that under our current circumstances, the guarantor system has outlived its usefulness and cannot be maintained. The best proof of a person's citizenship in Ghana is the Ghana card. The use of the guarantor system is fraught with blatant abuse as witnessed in the just ended voters registration exercise. Most countries in the sub-region, to mention but a few, for example, Nigeria, South Africa, Senegal, Rwanda, and Kenya, do not use the guarantor system as evidence of identification as a citizen. If indeed we are committed to strengthening our electoral process, then the guarantor system must be abolished sooner than later. We call on the government again to fund NIA. Additionally, we entreat Parliament to approve or pass the CI on the registration of voters. The Commission upholds the encouragement of minors to register. This is a crime. It does not augur well for us as a nation, and we urge all citizens and stakeholders to join the Commission to solve this long-age canker. The sad fact is that these minors were bussed to registration centers by citizens who should know better. This is unpardonable, and we once again call on the government to resource NIA to produce the cards and Parliament to approve the CI to enable us use the Ghana card as sole means to identify a person's citizenship. The Commission wishes to inform the general public that guarantors who breached the law and perpetrated the act of guaranteeing for more than 10 applicants will not go unpunished. Their names will be published in the national dailies and they will be brought to prosecution. It is in the interest of the Commission to register every eligible applicant or citizen. However, the Commission will not sit aloof to let go offenders who flout its laws. In our previous press briefings, we projected videos and photos of minors in queue registering. Again, as part of our efforts to ensure that every eligible voter gets registered, a directive was issued by the Commission to all its district officers to issue checks or numbers to all applicants in the queue on or before 5 p.m. to go to the registration centers the next day to register. This measure was to ensure that all applicants who went to the registration centers on the last day and were in the queue on or before 5 p.m. were registered a day after the deadline. Although some registration centers recorded some number of applicants in the queue, most centers had less than 50 in the queue, and in some cases even 0, as indicated below. For instance, if you look at Upper East region, the registration centers, Kasina and Nankana had 84 as at the time of closure. They had 84 in the queue. Then we had Kasina and Nankana West 45, Bogatenga Municipal 15, Bongo 15, and Talensi 14. Western North, Awin, for instance, there was no one in the queue, 0. Bibiani and Yasu Bekwai, 0. Seviwe also 48. Sevia Kontomra, 0. Bodi, 0. And Bia West, 0. If you look at Bono East, districts like registration centers like Abubu, Atebubu, Amentin, Pru West, Pru East, Sene West, Sene East, all had 0. As at 5 p.m. There was no one in the queue. We heard stories in the media about very large numbers of persons remaining in the queue after the last day and we wish to state that our checks reveal that there were no large numbers as being alleged. In any case, the Commission was successful in registering all persons who were in the queue before 5 p.m., but could not be registered due to the fact that registration ended at 6 p.m. And I wish to state again that they were provided with sheets or numbers by district officers and registered the next day. So these are few examples to indicate that not many applicants were in the queue as reported in some quarters of the media. The Commission also wishes to inform the general public that it has started replacing the ID cards for voters in the Gwan district. From Tuesday, 3rd October to Thursday, 2nd November, voters are required to go to the district office of the Commission at Likpemat to collect their new voters' ID card. Between 3rd and 9th November 2023, voters in the Gwan district will be required to collect their replaced voter ID cards at the exhibition center. After the exhibition exercise, the uncollected voter ID cards will be sent to the district office, and voters are expected to go back to the district office to collect them. This exercise has become necessary because in 2020, voters in the Gwan district registered in the Jasikan district. With the creation of the Gwan district, their voter ID cards bearing the Jasikan district code have to be changed to reflect the code of the Gwan district. Voters in the Gwan district are therefore entreated to go to the district office and the exhibition centers during the exhibition period with their old voter ID cards and collect the replaced ones or the new ones. The name, age, sex, ID number of the applicant on the replaced or the new voter's ID card remains the same, except the code of the district, the electoral area, and the polling station. Again, application for transfer of votes for both aspiring candidates and voters started from the 3rd and ended on the 9th of October 2023 at the district offices of the Commission. In all, 105,863 voters applied to transfer their votes to their new residents. In our bid to ensure that voters who have misplaced their voter ID cards are not overburdened, voters no longer have to travel long distances to the bank to pay for the replacement of lost voter ID cards. Applicants for the replacement of lost voter ID cards are to pay 10 cedis through the short code *222*1067#. Applicants are required to show proof of payment at the district office before being taken through the process for the replacement. Applicants shall be issued with a new or reprinted voter ID cards bearing the same details as provided at the time of registration, or, in other words, the same as the lost one. Replacement of lost voter ID cards is currently ongoing at the district offices of the Commission. This exercise started on Tuesday, 3rd October 2023, and voters who have lost their voters' ID cards should take this opportunity to visit any district office of the Commission to have their cards replaced. All applicants requesting for replacement shall be biometrically verified before their voter ID cards is printed for them. As stated earlier, the Commission is very much satisfied with the outcome of the registration exercise. At the end of the 21-day registration exercise, the Commission registered 910,996 persons as against the projected or the estimated 700,000. These are the regional distribution of the registration. Western region had 55,886, representing 6.1%. Western North, 31,483. Central, 85,152. Greater Accra, 124,166. Volta, 55,557. Oti, 26,481. Eastern, 92,780. Ashanti, 148,284. Bono, 31,922. Ahafo, 22,253. Bono East, 39,804. Savannah, 21,754. Northern, 76,510. Northeast, 24,667. And Upper East, 43,641. Upper West, 30,656. All adding up to the 910,996. Ashanti region recorded the highest number of registered voters with 16.3%. Savannah region recorded the least number of voters with 2.4%. The challenge cases were 9,720, and this represents 1.1% of the total number of people registered. So these are the regional totals for the challenge cases. Western, 557. Western North, 163. Central, 534. Greater Accra, 1,936. Volta, 1,392. Oti, 276. Eastern, 934. Ashanti, 1,232. Bono, 362. Ahafo, 125. Bono East, 408. Savannah, 326. Northern, 706. Northeast, 14. Upper East, 158. And Upper West, 597. Adding up to the 9,720. The pattern of the gender distribution of applicants where males outnumber females that emerged in the beginning of the registration exercise continued to the last day. Male constitute 51.7% of all the registered voters and female 48.3%. Apart from the Northeast and Upper West regions where females outnumber males, in all the remaining regions, there are more males registered as voters in this exercise than females. With Western region, male 29,492, female 26,394. Western North, 16,373 male, and then female 15,110. Central, 43,569 males, 41,583 females. Greater Accra, 64,390 males, and then 59,776 females. Volta, 28,089 males, and then 27,468 females. Oti, 14,494 males, and then 11,987 females. Eastern, 48,713 males, and then females, 44,067. Ashanti had 74,832 males, and then females, 73,452. Bono, male, 16,561. Female, 15,361. Then I have for male, 11,262. Female, 10,984. Bono East, male, 20,947. Female, 18,857. Savannah, male, 11,543. And then female, 10,211. I think the rest of the figures are here. We can actually give them to you when we are done with the press briefing. On the basis of the identification documents used by applicants the guarantor system dominates with 563,919, representing 61.9%. This is distantly followed by the Ghana card at 37.8% and passport at 0.3%. The irony is that the 2020 voters register has almost 61% of registered voters using the Ghana card. How we now have the Ghana card representing 37.8% is open to several interpretations. However, the Commission is convinced that the guarantor system has no place in our electoral democracy, and we call on all stakeholders to support the Commission's endeavor to use the Ghana card as the sole identification document for registration. The Commission, as indicated in our earlier engagements with the media, will roll out continuous registration of voters next year, including difficult to reach electoral areas. Each day, people attain 18 years, and the best way of capturing these first-time voters is by continuous registration at our district offices. As much as we would like to undertake long-term continuous voter registration exercise, would depend on whether the CI is passed or not. In the unlikely event where the CI is not passed, we have to undertake a limited registration exercise at the district offices, including difficult to reach electoral areas. Ladies and gentlemen of the media, we encourage all citizens and stakeholders to assist the Commission to uphold the integrity of the voters' register. Thank you.
Thank you.
Good. We want to now open the floor for the questions. We want to do the key version now. So when we are done, we ask all the questions. So,
yes.
The leader will summarize the key version. So when we are done, we'll start with the questions.
Yes.
Source of power, adding to your
Also, the Electoral Commission just announcing the latest figures on the limited voter registration exercise. Over 900,000, a little over 900,000 persons have been captured now on the electoral roll. 910,000 actually plus figures is what we're getting through from the Electoral Commission, invariably pointing out that they have exceeded the revised 700,000 figure that they put out earlier at the start of the exercise. We'll definitely be monitoring that announcement and also the further details that we'll be giving by Mr. Tete, who happens to be the Deputy Commissioner in charge of operations for the Electoral Commission, and bring you some updates. But it's all time will allow us here on The Pulse. With me, Blessed Sugan. For more news, just log on to myjoyonline.com. We have updates on our stories there for you. But the latest being that the Electoral Commission has registered 910,000 plus individuals now on the limited through the limited voters registration exercise, and there are further details and directives that the EC will be giving. We have all of that captured and will be brought to you here again on the Joy News channel when we bring you Joy News Prime. But that's all we have for you on The Pulse. We'll see you again, and next will be Let's Talk Showbiz. Thereafter, we'll bring you the 2023 National Science and Maths Quiz, which is at its quarter stage level, where many of the schools have been battling it out for the ultimate prize. Just stay with us here on the Joy News channel. We'll be bringing you all of the action. Thanks for watching. Bye-bye.